Hello, everyone. Welcome to another episode of APO Productivity Talk. So, my name is Zainuri. I have the honor of moderating the session or the episode of Productivity Talk today. So, this session is very special as we are joining by the winners of the African Kaizen Award 2025, a program that was organized by African Union Development Agency or AUDA-NEPAD and Japan International Cooperation Agency JICA. In this program, the APU Secretariat is one of the examination committee member for this award program. So, viewers, allow me to make a short introduction about the Africa Kaizen Award. So, this program or this award introduced in 2019, the annual awards are given to organizations that have made prominent achievement in quality and productivity improvement or Kaizen and can serve as the model cases that to be shared throughout the African continent. So last year, the program was held, the award ceremony was held at the South Africa in the month of October. So today we are very grateful to have the representative from JICA, and the most important thing, we have the winners, the outstanding winners of the three category, which is the first category. We have the micro and small scale organization, and then we have the medium scale organization and the large organization. So first of all, I would like to introduce our representative from JICA, Mr. Kimiaki Jin, the Chief Advisor, Quality and Productivity Improvement Kaizen Project in South Africa. Good morning, Mr. Kimiaki.
Good morning. Thank you for your introduction. My name is Kimiaki Jin, member of Examination Committee of Africa Kaizen Award. Same as Mr. Zainuri. I'm currently based in South Africa and operating Kaizen project, but also serving as an examination committee member. Thank you very much.
Thank you very much, Mr. Kimiaki. After this, we will listen to Mr. Kimiaki about the AKAC. What is the direction of the future of the AKAC, and after being implemented for more than 5 years, see that's what is the things that maybe will be improved or something that will be interesting later on shared by Mr. Kimiaki. So joining us from Mauritius today, I would like to welcome Dr. Nilesh Mohabir, Senior Cardiologist, Coronary Care Unit from Dr. A.G. G2 Hospital. Hi, Dr. Nilesh, how are you?
Hello everyone. I'm very fine, thank you. And it's a pleasure to be here to be discussing our project and gain valuable experience with others also present in that competition. So like presented before, I'm Dr. Nilesh Mohabir, Senior Cardiologist from the Coronary Care Unit, G2 Hospital, Mauritius, and I'm the team leader for the project.
Thank you, Dr. Nilesh. And it's not too late for me to congratulate you for winning the award this year.
Thank you, sir.
Okay, thank you. Next from Ethiopia, so allow me to welcome Mr. Amari Ashenef Alemu, Deputy General Manager, Daylight Applied Technologies PLC, the winner of Outstanding Award for Medium Scale Organization. Hi, Mr. Amari, how are you?
I'm good, thank you. My pleasure to join this conversation. As introduced, my name is Amara Chenef. I'm Deputy General Manager of Daylight Applied Technology PLC, the outstanding winner of in the middle category 2025 Africa Kaizen Award.
Thank you as well. Congratulations to be the winner, for being the winner for last year AKAC. Thank you very much, Mr. Amari. So we will meet again when I will invite you for the presentation later on. Thank you, Mr. Amari. Last but not least, we have Ms. Mesa Zagwani, Head Operational Excellence Department, Leone Wiring System, Tunisia. So Leone Wiring System is the winner of the Outstanding Award for Large Organization. Hi, Ms. Mesa. Welcome to the APO Productivity Talks. Hi.
Hello, it's nice to meet you all, and it's a huge pleasure for me to be with you here. My name is Mesa Zagwani, and I'm the Head of Operational Excellence Department in Leone Wiring System, Tunisia. and I'm here to present my company, Leoni, in Tunisia, as the winner of the Outstanding Kaizen Award in JICA. It was held in South Africa last year, and to highlight our Kaizen best practices with you. Thank you.
Thank you very much, Ms. Mesa. We will meet again when you make the presentation later on and sharing the story about the Kaizen journey in Leoni. So, ladies and gentlemen, viewers, for this second session, I will invite each of our guest speakers today. We're going to start with Mr. Kimiaki from JICA to share about the AKAC, or perhaps the AKI, which is Africa Kaizen Initiative overall. So without further ado, let me invite Mr. Kimiaki to start with his presentation. Please, Mr. Kimiaki.
Okay, thank you very much. I hope you can see my slide.
Yes, sir.
Okay, yeah. I'm going to introduce outline of Africa Kaizen Award, which was established in 2019 and continue up to now. Well, award is organized by AUDA NEPAD, African Union Development Agency NEPAD, and also JICA. They formed the so-called Africa Kaizen Initiative and provide the secretariat of this award as well. So vision, mission, and the strategy of the award. Vision is inducing value of growth and competitiveness among African companies. And mission is creating a continental platform for sustainable growth, whereby organizations that apply the continuous Kaizen QPI plug themselves into global value chain network. And then there are several strategies to realize those vision and missions. But the important point is that we are strengthening our rational and transparent selection of awardees through the participation process, which I'm going to explain later. And also, we want to strengthen our value addition and benefit of the award through encouraging companies and also Kaizen practitioners, quality and productivity improvement practitioners. So this is a evaluation criteria which we disclose to everybody in order to share our value as a continuous improvement practitioners. Criteria consists of 6 sub-criteria. First one is leadership. Second one is the process of Kaizen. Third one is Kaizen output. And fourth one is human resource outcomes, human resource development outcomes. And then business impact, then sustainability. So those issues are creating a cycle of strengthening our capacity to promote and also practices Kaizen. But in the center, human resource development outcomes is the key and influence to all the steps of our Kaizen practices. So this is a criteria, and we give score to the nominees of this awarding process, and total score is 200. Then for the selection, we organize the scoring process, 2-step scoring process. As I said, we received a nominee from the Kaizen practitioners in various African countries. Then we also invite scholars from those Kaizen promoting organizations. Then also make a joint scoring process. So not only examination committee members, but also scholars from each organization in the country participate. And then because of participatory process, there may be a tendency based on each scorer, like somebody give the higher score, somebody gives a lower score. So we use a standard score to adjust those tendencies and then evaluate the performance of Kaizen. First step is such a participatory process. Second step of scoring is done by examination committee members. So examination committee members are responsible for the result. So as Zainuri-san said, we have 3 categories: micro and small scale organization category, medium scale organization category, and large scale organization category. And each category, we award our outstanding performer and also excellent performers. Those 3 people are outstanding awardee in 2025. So last year, we received 10 companies from 6 countries in small and micro and small organization, and 10 companies from 8 countries in medium organization, and 8 companies from 6 countries in large scale organization. So that is the process, and then winners can explain more about Kaizen, I think. Thank you very much.
Okay, thank you very much, Kimiaki-san, for sharing the AKAC category, the assessment criteria for the information for the viewers. Okay, just a quick one. What about the AKAC 2026? What is the plan now?
Okay, yeah, we are now preparing for the notification of this award, and then encouraging the quality and productivity improvement, promoting organization in African countries to select their good practitioners, and then we'll request them to submit the nominating form by the middle of June. Then we proceed to the selection process, and then organize the awarding ceremony in Mauritius in October. So you'll see
this year the award ceremony will be held in Mauritius, yeah?
Yes, that's almost decided, finalized.
Okay. So, okay, thank you very much, Kimiaki-san. We will meet you again later during the panel discussion. So, thank you so much.
Thank you.
Now, we would like to move to the next presentation. Then we move to the winners, yeah? For all the 3 winners, we're going to start with a presentation by Dr. Nilesh, and then later on followed by Mr. Amari, and then the last but not least from Ms. Mesa. So, Dr. Nilesh, are you ready for your presentation?
Yes.
So basically, what we would like to listen from Dr. Nilesh is about the Kaizen journey in hospital. So it's very interesting to listen the Kaizen implementation. Normally, we listen from manufacturing, and now this is very interesting to have a presentation from hospital. So, Dr. Nilesh, now the floor is yours, please.
Thank you. Let me start by saying that this has been a wonderful journey. A journey of learning, of sharing experience, of gaining experience, and especially learning and adapting the Kaizen way in our day-to-day activities. So in this context, we use Kaizen to have a 0 waiting list for coronary angiography in 2024. Let me say that the first Kaizen activity started back in 2019, when we managed to decrease the waiting list from 90 patients to 30 patients in 2021. So the G2 hospital is a public hospital, and the coronary care unit is a unit where all emergencies regarding the heart come. So when the patient comes with a heart attack, this means that the arteries of the heart are blocked. We have very little time to unblock the arteries. We do it in 2 ways, either by putting a stent in the artery or by using a drug to dissolve the clot. So out of 5 regional public hospitals, there are only 3 with angiography facilities, including ours. In our department, we have 50 staff, including consultant in charge, specialists, GPs, ward managers, charge nurses, and attendants. Before 2021, patients admitted with heart attacks receive the drug to dissolve the clot instead of using the life-saving intervention. So basically, there was no proper protocol for life-saving intervention, which is the coronary angiography. The advantage of giving the drug was it was easy to use. However, it had lots of disadvantages. 30% risk of internal bleeding, high failure rate, very expensive, and all those who got the drug still had to do the angiography later. So the cost was even more. But most importantly, when we used the drug, which took 90 minutes to act, there was almost severe and permanent damage to the heart muscle, including long-term complications. So we might have saved the patient, but the patient would go home with lots of complications. And the reasons why they were not introduced, we didn't have enough qualified staff. There were better financial gain for doctors in private. Imagine you do one case, you get $1,000 in private, whereas in government service, you do 100 cases, you get the same salary. And there was an unethical approach of senior doctors instead of putting patients first. Most importantly, there was lack of leadership from senior doctors and the management. So we had learned the Kaizen way before. We started, like I said before, in 2029. We had managed to decrease the waiting time from 3 months to 1 month in 2021. We had managed to decrease the waiting list from 90 patients to 60 in 2019 and to 30 in 2021. And we had decreased the death rate by 20%. So the new objective was to have a 0 waiting list for coronary angiography. So we introduced what we call a revolutionary 24/7 free of charge primary angiography for all patients coming with heart attacks. This is a first in Africa, a first in public hospital because it's free of charge. So any patient coming with a heart attack at any time, 1 o'clock, midnight, 10 o'clock in the morning, we would do angiography straight away. So the Kaizen way was we started to analyze this by doing a problem mapping and analysis using a fishbone diagram. We use a Pareto analysis where we collected data. And the basis of the Pareto analysis was using the 80-20 principle, where 80% of the delay is often caused by 20% of the issues. We created a Pareto chart. We identified the key issues contributing to the delays. We implemented improvement actions based on the findings. And we standardized scheduling protocols to optimize slot usage, triage, and so on. We measured the results. We tracked KPIs, example, average waiting time for angiography, no-show rates, and so on, but most importantly, patient satisfaction. And then we sustain and standardize the improvements by creating SOPs based on successful practices. We shared these results and celebrated successes to build a culture of continuous improvement. Finally, we engaged patients and staff in this process. So what we did, we used what we call the PDA cycle. We introduced a pilot project. So between June 2021 and May 2022, any patient coming with a heart attack underwent immediate angiography. No drug was given to dissolve the clot. We did angiography. So no medication was used. Only 4 nurses were recruited because we needed a night coverage of staff, and the number of doctors stayed the same. Out of 117 cases done, only 1 was unsuccessful. So based on this successful pilot project, approval from the ministry, the protocol of heart attacks was amended. All patients coming to GT hospital now underwent primary PCI, or to put it in simple words, angiography. The most important part of this project was having quality circles at both local and ministry levels. Why? The main challenge was getting everyone on board. So we started with quality circles at our unit level, where we had the head nurse, head attendant, head pharmacist, head doctor. We met every Monday. Then we escalated to hospital level, where we met once every month. And finally, we got the minister on board, where we used to meet every 3 months at the ministry level. I must say here, because we had won our first project in 2029, the first Kaizen Award, the minister was more receptive to the idea. So implementing the next Kaizen project became much easier. And the results were outstanding. In 2021, we were doing approximately 20 to 25% angiography. In 2024, we did 100% primary PCI for all emergencies. And since we were doing angiography straight away, the patients did not go on a waiting list. So the waiting list decreased to 2.1 days for the waiting time, including 12 patients only in July 2024. Most importantly, because we were not giving the drug and doing angiography straight away, we saved around $700 per patient, around $100,000 per hospital, and around $500,000 per year nationwide. While we were expecting the death rate to decrease by 10%, the death rate actually decreased to even more, to only 2%, because we were using a more effective method. The added benefits, the number of beds actually doubled. So basically, before we were giving the drug, and then we had to wait to do angiography, the patient would stay 7 days. Now we were doing the angiography straight away, the patient would go home in only 3 days. So even though the number of beds stayed the same, the availability of beds doubled. Because we had saved a budget of 100,000 USD per year, as you might imagine, in public sector, it's not easy to get funds, but with the funds saved at our hospital, we managed to convince the minister to build a new operation theater to do more cases. The infection rate decreased to 5% because there were fewer complications, but most importantly, the patient went home almost with a normal quality of life. There were no or very few complications, so patient coming and leaving the hospital had a preserved heart muscle. We had lots of spin-offs and reciprocity. We managed to achieve the Sustainable Development Goal SDG 3. We were also covering other hospitals who didn't have angiography facilities, and we managed to train more cardiologists. For other staff, we created special uniform as a means of recognition. So wearing the special uniform means we are part of the coronary care unit. So more staff were motivated to join the team. For other units, seeing how we achieve national recognition, this encouraged them as part of a healthy competition. Everyone was now interested to know how we managed to decrease the waiting list and learn our technique. And as I told you, in the pipeline, we have a new operation theater being built, and we are also in the process of introducing cardiac rehabilitation in public sector, which is a first in Mauritius. Most importantly, we managed to introduce 24/7 primary PCI to all public hospitals since 2022 as part of a revised treatment protocol in what we call heart attacks. Furthermore, the government now encouraged us to go and educate the people. So my unit, including my boss, Dr. Shamlal, we were sent to encourage the people to talk about heart diseases, educate the population. We were asked to go for sensitization programs on national TV, and we got international recognition in international journals as a patient-centered approach, where we used to put patients first. So, like I told you, now primary PCI was extended to all hospitals in Mauritius, which is very rare in Africa. So that is my presentation. Thank you, and over to you.
Thank you so much, Dr. Nilesh, for sharing with us the Kaizen implementation in this hospital. We will come back to you later during the panel discussion. Thank you very much, Dr. Nilesh. So, viewers, ladies and gentlemen, we would like to continue the sharing session, the presentation, by inviting the third presenter. If you are ready, Mr. Amare, if you already ready with the presentation, may I invite you to start the presentation for the Kaizen implementation journey in daylight applied technologies. Please, Mr. Amare.
Okay, thank you. So I'll share the Kaizen implementation journey on Daylight Applied Technology PLC. So on the company profile, we are established in 1994 and managing under Midrock Investment Group. We are located in the capital of Ethiopia, Addis Ababa. Currently, we have 151 employees. With the company is established in 6.4 million USD, and in 2024 we were transacting 10.6 million. So our company is certified in different ISO standards: the food safety management system, occupational health and safety, the quality management system, and the environmental management system. We're producing the tin can and crown corks for the food and beverage industries. Our mission is to produce a variety of tin can and crown cork products for food and beverage packaging by utilizing the state-of-the-art technology and the skilled workforce to support the food and beverage industry. Our vision is to achieve a 35% market share in crown cork product and 90% market share in tin can product, which is used for food and beverage packaging by 2028. So our company sales and profit performance is from year to year progressing and improving. So the reason for Kaizen implementation was, as we are a manufacturer and we are working in a very competitive international business environments. Our customers are multinational companies. So to increase our productivity, to improve our quality, and to decrease the downtime is one of the concrete reasons. The second one is to increase employee engagement, to change our working cultures, to eliminate the non-value added activities in our operation, to create the conducive work environment, and to make the base for the other continuous improvement tools. These are the reasons why the Kaizen is selected to implement in Daylight Applied Technology PLC. So the Kaizen implementation started in the occupational safety and health module implementation in 2022. So next that, after the occupational health and safety implementation, we moved to the workplace organization and waste model identification and elimination and pilot problem solving on thematic areas. So the involvement of the company managers and workers, when you see that, we structured 12 the Kaizen teams or the quality circles and 5 cross-functional teams, which have different the waste and defect reduction, the safety, and the first aid teams. So based on this arrangement, we structure the QCs on each departments and functions. So the company-wide implementation is managed with these structures. The first thing is awareness creation. In collaboration with the Ethiopian Kaizen Excellence Center, we give trainings for the management, the Kaizen implementation training to the teams, the QC members, and the cross-functional teams. Different training is designed and delivered to all our employees. Like that, we follow the approach for the PDCA cycle. So the basic Kaizen implementation is followed by the Dreaming PDCA cycle, starting from the baseline assessment to the sustaining. So after structuring and all the training is delivered, the kickoff meeting is inaugurated by our general manager. And the Kaizen team meetings, based on the arrangement of the quality circles, the Kaizen team meeting is established. So on the 5S implementation, as you've seen, the 5 phases implemented starting from the shining, sorting, setting order, standardizing, and sustaining activities done in our factory company-wide level. So next to that, we go to the problem-solving Kaizen implementation. We prioritize the copper reusing problem. Since we are in sufficient copper utilization in our factory, we use one time that copper and we'll go to the scrap for the reprocessing. So by analyzing this problem, we design the set target and we design the root cause analysis and we design the countermeasures. So by working with our team, the rewinding mechanism for the coppers, as we've seen in the picture, the first we rewind horizontally and we reuse the 2 times that copper in our production process. Even the horizontal rewind is further improved to the vertical rewinding mechanism, which is compatible as the original copper. So by using this problem solving, our company have get different results. The first is the copper waste reduction, scrap reduction from 85% to 35%, and the copper saving, the monthly cost saving of 1.9 million Ethiopian birr was made on this problem solving. The other is the improvement work is performed, converting the LPG drying system to electric drying system. With this, there are different benefits we made on this project, the environmental aspect, the safety, and also the cost saving. The installation of mechanical lathe machine in factory workshop to improve our maintenance capability, to avoid the delays time, and also to minimize the cost saving and to improve our workshop capability for the maintenance. The third one, the improvement activity was developing the manual hydraulic extraction and press machine in our workshop. With our technical team, we designed the hydraulic extraction machine and we manufacture and we make ready for our workshops. With this, we cost saving and we improve our maintenance capability, the parts damage. And the fourth improvement work is on the safety. So to improve workplace safety through occupational health and safety project implementation. So there is one unit in our machine which have frequent safety risks in our employees. So we design the engineering control to avoid this safety risk and improve our safety for our employees. On the implementation process, there was challenge. The first challenge was lack of recording the required informations. Difficult to change the work cultures, the working methods from before Kaizen implementation and after Kaizen implementation. The third one is inability to maintain the arranged workplace. That's the sustaining part and standardizing part. The other challenge was assuming that the work done is small. So recording and documenting all results to measure the effectiveness of each activity's improvement. And the other one is not measuring the work in terms of value. So changing the improvement works to the value with the other challenge. So the other is the lack of planning activities. In the Kaizen project, every activity must be planned and executed accordingly. But in the startup of, mostly in this challenges was in the startup of the project, we face this challenge. The Kaizen results on the implementation of the project, the 5S result, the baseline was 43.26 and the target was 86.19. But after the implementation of 5S, we made the performance 86.79. The second result is the human skill development. We prepare a skill matrix for each employee based on function level and individual level. So based on that gap assessment, we deliver trainings and we improve our employee skills. When it comes to the quantitative results, the getting additional workspace, 146 meters square, getting different tools and parts, which is found by sorting activity, and the productivity improvement per day in the crown cork, we improve 25.4% improvement ratio, and in Tinkan, 69% improvement ratio. on the waste and defect reduction from 2022 to 2024, significantly in both production lines, in the crown cork and the tin can, from 0.29 to 0.03%, and from 0.2% to 0.03% reduction was made. On the customer satisfaction, from 78, the external customer, from 78.3 to 93.25% improvement is made, and on the internal customer, from 69% satisfaction level to 86% satisfaction level was made. Similarly, on the labor productivity is improved from year to year very significantly. The cost reduction in the copper reuse on 1 year, we made 60.3 million ETB, Ethiopian birr per year, and also on the LPG to electric conversion, 5.5 million. The profit margin before Kaizen implementation was 7.66%, and after Kaizen implementation, we made 30.8% profit margin due to the cost saving and the productivity improvement. The accident rate also significantly improved. To overcome the challenge, we follow the PDCA cycle. So on the plan phase, the team formation, the training, the baseline assessment, the goal setting and action plan, the budget preparation and the kickoff program is done properly. That supports us to overcome the challenge. On the implementation phase, the OHS risk assessment, the 5S, the waste and mood identification and elimination, the copper consumption reduction by problem solving, and the different improvement initiatives were done. On the checking part, we were using the internal audit and also the external audit, the management Jembaok. This supports us to overcome specifically on the challenge on the sustaining and on the standardization. So on the ACT part, we done on the standard setting, the Kaizen policy, the implementation manual, and also the benchmark visit, the internal and external company best practices, the top management patrolling, and the integrated management system policies and audits support us on the ACT phase. So to sustain this, the Kaizen implementation, we set policies, we set the internal audit procedures, and internal audit team is assigned by general manager. So every month, every quality circle teams will be audited with structured checklist and written feedback is delivered. So the management will discuss on that feedback and will take the necessary corrective actions for the improvement. Every 2 months, the management will go to the workplace, will review each quality circle activities that will also support us for continuous improvement. Our company is involved in different social activities, so in kind and financial supports for different humanitarian organizations and the environmental and social sustainability works. So financially, the companies allocated the 10% of net profit every year for the corporate social responsibility activities. So from year to year, we are improving our contributions, starting from 4.8 million per annum in 2023-24 budget year, 10.9 million is allocated for corporate social responsibilities. Thank you very much.
Thank you very much, Mr. Amare, for very comprehensive presentation about the implementation of Kaizen in your company. So thank you so much. I will come back to you later for the discussion about this presentation, about this implementation of Kaizen. Let us invite the last but not least presenter from Leonie, Miss Mesa. So this company located in the capital city of Tunis, in Tunis.
No, it's located in different regions in Tunisia, in 3 regions, not in the capital, but in Sousse, Monastir, and Matar, region F in Tunisia. and we are specialized in wiring harnesses for conventional car and electrical car. Our customers generally are Volkswagen, Mercedes, BMW, Audi, and so on.
Okay.
Founding year was in 1977. We are
Okay.
hiring more than we are hiring people more than 23,000 employees. So we are considered as a very big industry. Located in 3 regions, but we have 5 plants in Sidi Bou Ali, Benz El Hayat, Msadi, Mater, and Mater North and Mater South. So we are in total 10 plants, 10 projects in Tunisia. We are winning so much awards, just like the award for first investor of the year. We already honored as the best CSA partner award, and so on. So talking about the leadership in Leoni Warning System Tunisia. So basically, we start from the vision. We always fix a long-term vision. We fix our strategy for this year. We fix our management commitment, and then the challenge began each year. So our vision is to be the best in class, to be flexible, to work on employee retention and growth, and also to integrate or to involve the automation and sustainability in our management or in our strategy. Our country vision is start with a top level direction or a top level decision, and moving from the level to another level to the line level, which is the bottom up. So we are practicing so many lean tools such as Gimbal Walk from the top management, and not only from the top management. The Gimbal Walk is also one of the production or the shop floor tools that each plant use. Also, QRQC, the quick response to quality control, the daily meeting, and so on. Coming from the motivation, the operator, we also have so many motivation sort, such as each week we have a best employee, each month we have the best team, we honorate the best team and our people. We have also OPEX award for the plant, and also we have the big event of Leoni, which we honorate the best project, and so on. So the cycle start by PDCA, plan, do, check out. So we always plan and we fix our vision. Second, we start the execution of our projects, such as the kata coaching, site management, SMAD project, value stream, data analysis, and so on. And then we check where are from our KPI targets. So by using a regular meeting, Gimbal Walk, the brainstorming session, workshops, also reviewing our status VS target, and by QRQC, QRMC, or KUZU. And the third, which is ACT. So in this level or in this part, we try to reduce cost and ensure saving, improve our employee skills, and empower idea, and using also recognition events as I'm talking with you. And the cycle continue by using always this PDCA. So our Kaizen activities process are basically based on using kata, the daily coaching analysis, KUZU management, which is tools we use to track efficiency and to track Muda hunting. It's like a Muda hunting tools, and also the quality circle, which these tools used in a regular basis in our daily routine. Also, we use also in the real-time tracking, we have the large report for scrap data, very pertinent data that are shared and the report daily with all the team. Also, we have labs for output tracking, the output tracking for each line reported directly by using the visual management in all the shop floor. And we also have Leoni Marketplace to track and to report our CapEx and fixed assets. Third, reducing Muda. We also have so many actions and smart actions to reduce MUDA by a very simple and practical action like detect overprocessing, reduce defects, reduce time waiting, and so on. And this is here I share an example of a simple action that have a very, very big saving. Moving to the third slide, which is Kaizen outputs. All of this daily routine in the shop floor and our smart action can only impact our KPIs. So in the quality level, we are here talking about the ppm. So the official ppm country deduction, and here I share with you the tendency between 24 and 23. So as well as you can see, the ppm is very, very well reduced. We are talking in year-to-date 24 with 4 ppm. And in the productivity level also, the country efficiency improved from year to year. And not only efficiency is also affected, the OE, overall efficiency equipment, is very, very well improved vs last year. And more than that, we are working on workstation ergonomics. So by using Rula methods for ergonomic of workstation, and also by implementing some automated machine or equipment that can support our employee, just like material transport change from employee to Skytrack. Moving to the fourth slide, yes. HR development outcomes. So Leone Warning System is very, very well known by skills development projects and motivation system. So here we are working in our employee flexibility, which is a very, very important topic in Leone, just to cover fluctuation of our people and also the customer ups and downs. So we are working in the flexibility for our direct employee and for the indirect ones. And the KPI below can very well show the tendency between year to year and the improvement of our direct flexibility and also fluctuation. The motivation events also are very, very intensive. Just we have the best team, best segment, best employee, ideas gift also for CIP. We have also the Leone big event, which is a big event in Leone. We honor our project pilot, we honor our best plant, we honor also the best department, and so on. We have football competition award, the team building, and so many more. Moving to the fifth slide, the business impact. So here I'm sharing with you the customer satisfaction and the spillover environment. The customer satisfaction is very, very well known. We are classing, the customer put Leone in the class A. And here I share with you the Forestia customer result. For the spillover environment, we have Leone Kindergarten, which is we have next to our plant in the same site a kindergarten that allow our employee to put there their children and to not feel anxious or think about their situation. They are just next to them. They can reach them at any moment they want. And we have also International Literacy Day, Circumcision Day, Loyalty Day, Women's Day, 3 days, and so many partnership with the University in Tunisia of Engineering School, and so many forum that we want to impress our students to come to Leone and make their final graduated work project there. Moving to the next slide, which talking about sustainability. So all of these events and this hard work and daily routine and shop floor project could only impact Leone operating system in terms of audits. the audits can ensure the continuity of this Kaizen actions. And also we have Leone operating system, which is annual audits that aim to check that every standard in Leone and every Kaizen practices is running in the right way and in the good way. Also, we have the critical process audit. We have some critical process that customer want to make a very huge focus on it to not have rework or a major problem. So we are making here critical process audits, which is in a monthly basis across all the plants. Also, we have the project go live audit. We have canteen audit and survey of satisfaction for each event. Each event we make, we launch a survey just to know the satisfaction of our employee, and also best practice sharing platform that we share all our best practice sharing with all the plants. And then the next part for the next year start with CAPDO. We fix, no, you can move. Yeah, you are right. So the next, we are each year we fix a target, and we fix such target because we are not only working to reach the target, we are working to reach more than the target. And every year the challenge began, and we evaluate ourselves from, for example, here 24 achievement. We are putting another target for 25 and another such target for 25 for our major KPI or financial KPI, which are efficiency, OE, scrap, WEEP, and so on. So this is our routine for Kaizen implementation. And I want to share with you a video, but unfortunately I cannot send it yesterday, but just to show you our routine and our plans. Thank you very much.
Thank you very much, Miss Misa from Leone. Okay, thank you very much to all the presentation and the presenters for sharing the Kaizen implementation in your respective company. And also I would like to thank Mr. Kimiaki for sharing the Africa Kaizen Awards, what should I say, the criteria, the categories, etc., etc. So now we go to the third segment, which is the discussion. So to start this discussion, I will give a questions to each of you. One question each, different questions. So then after that, I will ask each of you to give advice to those who want to start Kaizen, yeah, based on your experience. Let me start first with Kimiaki-san, Mr. Kimiaki from JICA. So yeah, I've been involved in this AKAC and since 2019. Thank you very much also to JICA for having us as part of the examination committee. So just a quick one to you, Kimiaki-san. How do JICA measure maybe the impact of Africa Kaizen Award to the entire AKI program itself?
I think that is a very good question. Africa Kaizen Initiative has various activities, organizing annual conference and creating standardized curriculum for Kaizen training, and also appointing Center of Excellence to spread the Kaizen activity in neighboring country in Africa. Then award itself. Award is kind of a common value that we want to share among the Kaizen practitioners. How we strengthen our activities and how we, target our improvement is kind of issues we can share. I mean, through the awarding process. So these days, number of the countries to participate, to join in this awarding process is increasing. And then, 7, 8 countries are regular members, but also spontaneously several countries joined. So in terms of the impact, it's not easy to quantify the value of Kaizen Award, but obviously we are sharing the bigger impact of Kaizen initiative through awarding process.
Thank you
So
so much, Mr. Kimiaki. Maybe based on your experience, the numbers of what should I say? The number of enrollee and the numbers of participating countries, I'm sure is growing from year to year.
Yeah, well, when we start our awarding process, number of nominees are about 2015, but now increasing up to 30.
Oh, okay.
So yeah, we are expecting more through our participatory process.
Thank you so much, Mr. Kimiaki, for sharing your insights about the AKAC as well as the AKI as the entire Kaizen initiative from JICA to the African continent. Okay, I'll move to the the evening companies. Let me start first with Dr. Nilesh. Dr. Nilesh, thank you so much for sharing with us. Very interesting, talking about the QCC implementation in the ministries as well in the hospital. And my question is about leadership. I think you also mentioned to bring everyone on board is not an easy task. So here, in doing this kind of activities, especially Kaizen, we are very sure leadership plays very important role. So please share experience. So how leaders actually can bring all stakeholders, all employees, all people to come in together to implement the Kaizen. Please, Dr. Nilesh.
Well, first of all, let me tell you that to work in the public sector in any country is quite a challenge, because as you might imagine, there is no necessary financial benefits out of it, unlike a private company. So in order to get everyone on board, first of all, you have to motivate the staff. This is a very important thing. Once you've been able to motivate the staff, you won't believe how much they are keen to help, how much they want to improve, and how much they want to learn. So to be able to do that, you need someone who can come with a clear message of how to improve the system. In our context, we had to do it with the budget allocated. We didn't have other source of income. So what we did was quite simple. We selected each head of each department. For example, the senior doctor, the senior nurse, the senior attendant, the senior pharmacist. And we had them in a meeting, which we called the quality circle. So having the input of each and everyone was very important, because once you have each input, they feel important. They feel part of the project. And the leader has to come with a clear mission, because it can be successful in one hospital, but if you want to make it successful elsewhere, it has to be standardized and it has to be sustainable. And this was the big challenge. And I must say that the first award, which we won in 2019, helped convince the ministry at national level that somehow we were doing a good thing. And we had direct contact with the minister for implementing our project.
Thank you so much, Dr. Nilesh, for sharing experience, how the leadership plays very important role in make sure that the successful implementation of Kaizen in the public sector. Okay, I move to the second speaker, Mr. Amare. We are talking about the challenges. I'm sure that you also face many challenges in adopting Kaizen. Initial challenges while want to introduce to the companies, especially the employees. So can you share with us what was the challenges and how you overcome those kind of challenges when implementing Kaizen, please, Mr. Amare?
Okay, thank you. Yeah, when implement Kaizen, it's a new project. We're designing the new working system, and everyone have to change the working system. They have to contribute for the Kaizen project. So the very beginning challenge was, as mentioned in the presentation also, the know-how part. So knowing how we implement the Kaizen system throughout the company in every activity and every function. how we implement the tools and the working methods, the systems. That was the know-how part is one thing. The second thing, the change resistance. So every person is naturally wants to work with the existing methods since he's comfortable or we are comfortable for that the current existing method. So to introduce the Kaizen way of working, we have to challenge the status quo, the current working systems. So change resistance is one of the major challenge. The second thing, the sustaining and standardization. So we will do with the one activity or we'll implement one tools for some periods, we'll meet some results. So to sustain and to standardize, to create the habit of working frequently like that and sustaining that activities, that working methods. This was the summarized challenge in the Kaizen implementation. So to obstacle this to overcome this challenge, the first thing is the management or the leadership commitment is the major tools that we support and we used as company also. So the leadership must know the system very well, must have trained, and also must have confidence that Kaizen will help us to meet our vision and mission. So if we align on that, the commitment will come because every company's leadership will work for the attainment of the mission and vision of the company. So Kaizen, if we believe on that, Kaizen will help to meet our vision and mission of the company. The commitment, the alignment will create on that. So after that, the know-how, the training, and the second is the leadership, the leading of the project. So properly planning, if we know the system, if we know the tools, if we know what we will implement in the project, so we'll work the proper planning, the required resources. So if you allocate the required resources and if we follow the M&D, the monitoring and evaluation, if we make it that the Kaizen project agenda on every management meeting, if you follow the progress, if you go to the workshops, the floors, the gem box, if we make the management and the leadership, when we make it the top priority, every middle management will make it the priority because the tone is set in the top. So that we use that approach in the daylight also. So we were doing at the establishment at the initial phase, we will gem box every week the management. We make 2 teams of the management and we will go to 12 quality circle teams, what we were doing in the last week and what we are planning to the coming weeks. We'll ask that and we'll see the Kaizen boards. So we'll give the feedback on the oral discussion and also we'll give the structured written feedbacks. So that is the one thing. The other, on the sustaining and standardization, we use the developing systems, the policies, the manuals, the procedures. That was the one thing. The second thing is the rewarding system. So we recognize and reward every individual's teams for their results based on the standardized evaluation and the rewarding systems. We give the rewards for the teams and the individuals. So by designing these systems, we can tackle the challenge.
Okay, thank you so much, Mr. Amari. You already mentioned about sustaining. So I will listen to what our speakers from Tunisia, Ms. Mesa, when we talk about how to sustain the Kaizen implementation. And of course, you could also share with us what do you see the future of Kaizen in Africa, Ms. Mesa, if you can give your opinion about this.
Okay, the future of Kaizen in Africa, maybe this gives me talking about Tunisia first, because we as Leonie, and I know some of other of other enterprise in Tunisia. They are working very, very hard in implementing the Kaizen activities, because people here are really convinced about the impact, the good impact, and the deep impact of Kaizen activities in our daily routine and in our and industrial future in Tunisia. I will start first with Leonie, because the Kaizen activities in Leonie now has reached more than 20 years of implementation, and now it becomes not only a project, is a mindset, because now we are not talking about just a project, close it and that's it. No, we are talking about a mindset that all people are engaged in it and working to make it better every day. Every day, 1% of improvement. Every day, 1% of smart action and fast action, and so on. So in Leonie, Tunisia, the development of Kaizen activities become very, very faster, and the impact can really show very clear. And compared Leonie with other enterprise in Tunisia, specialized especially in wiring harnesses, because we have a very, very competitors in Tunisia that make the competition very challenging with each one of them. They already shared the same view, let me say. They are working to detect what's the best practice in the other country. I want to implement it. I want to be the best one. I want to be the top one in Kaizen activities, and so on. So for Tunisia, it's very, very developed. And let me say, by implementing this type of challenges each year, for example, the Kaizen Prize, it's one of the best decisions and the best events that can really engage all the enterprise in Africa to know what means Kaizen, and to implement the projects and to implement this mindset in their country and in their region, and to become the best in class or the best enterprise in all Africa. By using this kind of motivation and this kind of challenges, the Kaizen activities in all Africa will be each year developed from the other year, and so on. So it's very, very good for me, and I can see a very good future for the Kaizen activities, because now it's very well known. There's nobody, everybody, I guess, they know about Kaizen, every industry, and this is a very, very good sign for me.
Thank you very much, Ms. Mesa. Thank you very much for your very optimist and positive towards the future of Kaizen in Africa. Thank you so much. Okay, thank you so much, all speakers. I think because of the time, so we need to close this session today. But before that, I would like to invite each of you to give your advice, especially to those organizations who would like to start Kaizen. Okay, give your very, what should I say, short but very sharp advice to all of them. I will start with Ms. Mesa first. What is your advice? Yeah?
Okay, yes. Okay. The best advice that I can ever share it with you and with all people, maybe, it's to never give up. The hard challenge in implementing the Kaizen activities is not to know the tool. It's maybe people, how to convince people and how to implement, because it's a mindset. We are not talking about a project. So don't give up on people. One day you will reach the result. One day you will see this improvement, and you will see that this mindset is very well implemented. But just you need to be perseverant, to have a very long breath, and to never give up on people. You need to implement each action by patience. You will see so many people resist and so on, but just Don't give up. That's it.
Thank you. Thank you. Very, very, very nice. Advice. Never give up. That's the most important thing. 3 words.
Okay.
Never give up. What about you, Mr. Amare?
Okay, thank you. So my advice for the companies which are not implemented the Kaizen yet is on that I can quote on believe on Kaizen. So what do you mean that believe on Kaizen is? There are different systems which can support us, our operations or our company to meet our vision and mission. So the Kaizen will help us if we believe and if we properly understand and use tools, we can, based on the Kaizen working system, we can live our mission, we can realize our vision of our company. So by believing on the Kaizen, if you implement properly on the basic Kaizen level, then we'll go to the advanced Kaizen level. And also it will be the foundation for the different systems. As our company, we are going to TPM on this year. So for the TPM system, the basic Kaizen implementation will be the foundation. For many systems, for TQM, for other systems also, the basic Kaizen will be the foundation. So believe on the Kaizen and realize your mission and vision will be my advice. Thank you.
Agree with you. So never give up, believe in Kaizen. And what about you, Dr. Nilesh?
I must say that Kaizen in the public sector is a big challenge. Why? Because there are structures already in place in the public sector. So what Kaizen brings is how to increase productivity with limited resources or maybe the same resources. It brings change by implementing very small, so big changes or big progress by implementing small changes. I think this is the major thing in Kaizen, bringing Kaizen to the public sector, how minor changes can bring long-term processes. And on that note, I welcome you all to Mauritius this year. I hope we'll be able to discuss more about it.
Thank you very much, Dr. Nilesh. Kimeki-san, you are the one behind everything, yeah? AKI, AKAC. So what is your advice? And maybe you can also take this opportunity to promote AKAC 2026 to our viewers, which include also those people in Africa. And yeah, please, I give you this 30 seconds.
Okay, thank you very much. Yeah, if you Google or check the AI, you can find lots of information on Kaizen and different types of quality and productivity improvement modules. So, well, you can start. But the important point is that if you want to go faster, you go alone. But if you want to go farther, you go together. So please create a team and group, colleagues, and then make the progress step by step. That is the important point. And that's why we are promoting Africa Kaizen Initiative. African countries, not only one country, but we can work together and then create a bigger momentum so that African future will be much brighter. So that is my message.
Thank you very much, Mr. Kimeki. So, ladies and gentlemen, Ms. Mesa, Mr. Amari, Dr. Nilesh, and Mr. Kimeki, thank you very much for your time today, and thank you very much for sharing your valuable insights and your experience, as well as your opinion and views about Kaizen implementation Africa. So we at the APO hope that this sharing session, even though that those presenters and speakers are coming from the African continent, which is not part of the APO members, but we do hope that this sharing session can give us our stakeholders here best practices sharing from our friends in those continents about Kaizen implementations. So viewers, ladies and gentlemen, we hope that this sharing session today will inspire you on how to implement Kaizen, and of course it's overall on how to enhance the productivity either in private or public sector. So once again, I would like to remind all of our viewers and over there. So if you have any comments, if you have any questions later on, you can just put it in the comment section in this YouTube channel. So we hope that we can respond to you as soon as possible. So thank you so much, everyone. So we hope that we can meet up with you face to face. And of course, I would like to advise others, if you can continue following our social media, APO social media, either Facebook, our LinkedIn, our YouTube, or other things. Even you can go to the website to get the update on our program and activities. So thank you so much, everyone. Please take care, and hope to see you. Goodbye for now. Thank you so much.
Thank
Goodbye.
you.